there, it's Christine from Nurse in the Making, and today I'm going to tell you 5 tips on how to pass your nursing school pediatrics class. In peds class, you are dealing with pediatric milestones, pediatric dosage calc, and pediatric patients. This class actually ends up being really different than what people think, because people think, I've worked with kids my entire life, I'm going to ace this class. No, you need to be thinking of this class as medical pediatrics, not like real life children. Which brings me to my first point. Don't compare to real life scenarios. When you are on an exam question and you start to think of what your little niece did when she was 1 year old, or what your kid was like when you babysat them, you're probably gonna get that question wrong. You have NCLEX children, and then you have your real life children. They are not the same thing. So be sure to think of how the textbooks and the NCLEX wants you to answer it, not comparing it to real life. I know that can be really hard, but just a warning. I see this happen a lot in pediatric milestones, which we're gonna cover in a second. Let me walk you through an example. For the NCLEX, a child at 2 years of age should be saying 2 to 3 word sentences like play outside. But if you think of your little niece who started talking up a storm at 15 months, it might confuse you. Remember, the NCLEX has very specific standards in place. Passing this class requires knowing and remembering those standards. So, moral of the story is that the NCLEX child always wins when answering pediatric questions. All right, tip number 2 is related to pediatric milestones. My first tip for this is to study each milestone by age group. Don't think of pediatric milestones as an entire whole section. It will 100% stress you out. So when you are studying this, divide milestones into age groups. These age groups are newborns, infants, toddlers, preschoolers, school-age children, and adolescents. This will make it easier to focus on and remember key points for each group. Don't try to sit down and study all the milestones in one day. It's not possible. It's like pharmacology. You would never sit down and study all the medications that you're gonna learn in that entire class. It's the same for this. So please study each milestone by age group. Don't group them all together. Your brain, it can't handle it. Trust me, I've tried. Doesn't work. One more tip about pediatric milestones. You wanna break each milestone into 4 categories. The 4 categories being gross motor skills, fine motor skills, language, and cognitive. This is actually how I lay out the milestones in the pediatric flashcards. The link to these flashcards are in the description below. Okay, so the moral of the story with pediatric milestones is to really break them apart when studying. Break it down by age group, then from there into 4 categories for each milestone. All right, tip number 3 is to practice dosage calculation. I know some of you cringed when I said PEDS dosage calc. Students really struggle with PEDS dosage calc, but don't give up on it. You need to know it for this class. Let's walk through an example on how you can kind of tackle these questions. A child weighs 20 kilograms. The prescribed dosage for amoxicillin is 50 milligrams per kilogram per day in divided doses every 6 hours. How many milligrams should the child receive per dose? So the prescription is 50 milligrams per kilogram per day. So we can plug in our information. 50 milligrams per kilogram times 20 kilograms equals 1,000. But to get the proper units, we can cross out kilograms, leaving us with 1,000 milligrams per day. Remember, that's what the prescription gives us here, per day. But the question asked per dose, and the prescription is given per day. So be sure to read the entire question because 1,000 milligrams is actually wrong. We need to answer in per dose. We know the prescription is 1 dose every 6 hours. Well, that's 4 times per day, right? Because there's 24 hours in a day. 1,000 milligrams over 1 day multiplied by 1 day has 4 doses in it. We cross out the days, leaving us with 250 milligrams per dose. It's not too bad when you break it apart, but let's do another question. I'm gonna throw one more thing in there to make it a little bit more challenging. A child weighs 30 pounds. The prescribed dosage for acetaminophen is 15 milligrams per kilogram per dose every 4 hours as needed. How many milligrams should the child receive per dose? All right, time to crunch some numbers for our little patient here. So the child weighs 30 pounds. But the formula gives us milligrams per kilogram, so first we need to convert pounds to kilograms. The way you convert pounds to kilograms is to divide by 2.2. So 30 pounds times 1 kilogram over 2.2 pounds. We then cancel out our pounds, leaving us with 13.64 kilograms. Now we can fill out our formula. So now we know our patient's weight in kilograms. The prescription is 15 milligrams per kilogram per dose. So we can plug in our information. 15 milligrams per kilogram times 13.64 kilograms equals 204.6. But to get the proper units, we can cross out kilograms, leaving us with 204.6 milligrams per dose. Now we can round this to the nearest appropriate dose option, which is 200 milligrams. Something to really pay attention to is that the other question gave us a formula per day, but this one gives it per dose. So always be sure to watch out for that wording when doing dosage calc questions. So again, practice pediatric dosage calc questions. It's really the only way you're going to get better, so keep at it. All right, tip number 4 is to know what is normal versus what is abnormal. This class is all about recognizing concerning signs and symptoms, educating our parents, and then how to walk through and handle these various diseases that our pediatric patients will have. So when you read a question, you need to know like, oh, that's normal, or oh my gosh, this is an emergency. We need to care for this right now. I'll give you some examples. So jaundice before the first 24 hours of life is abnormal, but jaundice after the first 24 hours of life is normal. Again, you need to know the normal versus abnormal. All right, let's do another example. Let's say the child presents in a tripod position and they're drooling. Normal or abnormal? Definitely not normal. This could indicate epiglottitis, and you need to know how to care for this. So again, be aware of those big killer diseases and emergencies and what's normal versus abnormal. The NCLEX is all about safety, especially in our little pediatric patients. All right, last but definitely not least is tip number 5, understand pediatric anatomy. Children's bodies are so different from adults. Understanding how they're different can help you understand diseases a little bit better. Let's walk through some examples. So let's say the infant has edema in their airways. You can see here it's even more serious in an infant than it is in an adult, again because those narrower airways. Another example is infants have shorter, wider, and flatter eustachian tubes than adults. You can see here how the adults' tubes are tilted, allowing for that drainage. So flat, non-tilted eustachian tubes make ear infections more common in children because they don't drain well, leading to bacterial growth and stasis of all that fluid. These are just 2 examples of how understanding pediatric anatomy is so crucial and can help you really understand rather than just memorizing all of these diseases. For me, when I understood the why behind something, it actually helped me retain the information much better. If you are in this class, you will love these pediatric flashcards. Studying using flashcards allows you to find out your knowledge deficits way before the exam. It covers developmental milestones, diseases, and pediatric anatomy. Not to mention all the visual aids like comparison charts, diagrams, pictures, and of course, memory tricks. You can find a link to these flashcards on my shop, Nurse in the Making, but of course, they're in the description below. Happy studying, future nurses, and to all my future pediatric nurses out there, you got this.